Hi everyone, welcome to today's section. I'm excited to share my knowledge with you about this glycated hemoglobin test and its important role in diabetes care. Please, if you're not following us, please try to follow us, like, share and comment. Okay, let's get started and learn together. What are the rules of glycated hemoglobin in managing diabetes and in diagnosing diabetes? 1 is accurate measurement, 2 is screening, and 3 is diagnostic criteria. This test we are talking about is last session we discussed about what glycated hemoglobin is all about and what diabetes is all about. So today we are talking about the roles of glycated hemoglobin in diabetes care, in managing diabetes. This test we're talking about is very important. Many studies has investigated the diagnosis of diabetes using glycated hemoglobin. It is used as an indicator for the risk of complication with patients diagnosed with diabetes. It is not affected by diet or by time. It can be done at any time. This test we're talking about for patients with diabetes, it helps to know how well they manage their diabetes. This test we're talking about is very important. It is used for screening. Screening what? Some people will be thinking it's used for screening. What are we screening? It is used for screening high-risk individuals. Individuals that have history of diabetes. Individuals that their father has diabetes, their mom has diabetes, their great-grandmother have diabetes, in their history they have diabetes. This test is used for screening. When you are in this situation, like you know that your father has diabetes, you know that your mother has diabetes, and you have not checked your glycated hemoglobin level before, it is very wrong. This test is used to screen. It is used to what? Screen. It is used in screening high-risk individuals. Do well to check your glycated hemoglobin level if you know your high-risk individuals. And accurate measurements, number 2, yes. Some people will be thinking, which one is accurate measurements? How is this accurate? This test we're talking about provides a reliable, accurate average of blood sugar level for the past 2 to 3 months. It is used to measure the level of your glucose in the blood for the past 2 to 3 months. We said that before in our last section. It gives a reliable result. It gives a reliable average of your sugar level for the past 2 to 3 months. 3, diagnostic criteria. It is used as a diagnostic threshold for diabetes. This test we are talking about is very important. Please, my lovely followers, please, if you have not done this test, try as much as possible to go to any laboratory near you and do this test. Check your sugar level, especially those with the history of diabetes. Please. And if you know that your mom, your dad is having diabetes, and this test, you have not even done this test for him or her before, it is very wrong. Your mom is having diabetes, your dad is having diabetes, you have not even done this test. You are checking fasting blood sugar, random blood sugar, all those fasting blood sugar and random blood sugar. Measure the level of your glucose at that particular moment, at that specific time. It does not measure the level of your sugar level for the past 2 to 3 months. It is this test, it is this glycated hemoglobin test that measures the level of your sugar level, the level of your sugar in the blood for the past 2 to 3 months. It is very important. My lovely friends, try as much as possible to do this test. It is very important. Please, if you are not following us, try as much as possible to follow us. I love you all. Meet you in our next section. Thank you and God bless you.